I'm so excited about your new book and everything that's been going on.
Thank you.
How do you feel?
It's been a lot of fun. I mean, I've been very excited to see that people are so interested in talking about vaccines and so interested in having discussions about it, or at least more people are than ever were before. And that's a really different place than it was a year ago.
Yeah. And you were not holding back anything this time? You really, in this new book?
I don't hold back in this new book. I don't think that's very useful at this point. What I did was I tried to be science-based and evidence-based. So I'm not trying to be conspiratorial. I'm trying to discuss what information we actually have, what's out there, the big questions that parents have on vaccines, talk about autism, talk about sudden infant death syndrome, talk about long-term complications, and discuss the information that we have and what the research shows. And you can go in a wide tangent on both ends of, air quotes pro-vax or air quotes anti-vax, but I'm trying to keep it in the middle and show both sides of the discussion so that way we can get to a better place to actually have discussions about these things. I mean, I guess, it's important to mention that I'm not against vaccines. I think that we should have discussions. My position is the same in the office as it is in the book, as it is in general. I've been asked about vaccines so much, and I feel like people should be able to make the decisions that are best for them. We should get people the information so that way they can make a choice, what they feel is right for their family, and we shouldn't be forcing people to do anything. People in my office do the regular CDC schedule, some do the slow schedule, some don't do any, and that's up to them at the end of the day. And I don't tell people what to do. I just provide information. And the goal of the book, Between the Shot and the Hard Place, really is to open up that discussion that we haven't been able to have. Vaccines are, as a word, so censored. We couldn't have any conversations before. It was really difficult to have them. And as soon as you say the word, everyone seems to go nutso and starts fighting about everything. And that doesn't help progress forward. And I think we need to build bridges and be honest about the information we do and do not have so we can get better research and more research and have discussions, because at the end of the day, we want healthy kids.
And what is your thought on the vaccine schedule as it is for now?
So, I mean, my general thoughts on the vaccine schedule is that when you look at everything, there are more and more vaccines that we have been told to give to our kids over the last few years. And I think that a lot of parents are concerned about whether it's too many vaccines, we're adding more and more, or what the motivations are behind some of these vaccines. I think it would be very arrogant for me as a single person, a pediatrician, to say that I know more than the CDC or I know better than the CDC. So again, I don't tell people what to do. I just think that we need to have discussions around it. And there are a lot of concerns around how many vaccines there are. And I think that's a reasonable concern to have. And so we should be able to discuss it.
Okay. Let's start with the hepatitis B.
Mm-hmm.
What's your thought on giving hepatitis B to a newborn?
Yeah, so it's a great place to start. So I think that it's a very important conversation to have around the hepatitis B vaccine and kids. Before we get into it, so hepatitis B, it's a liver infection. The main way that you would get it as a newborn would be from passage from mother to baby. When it first came out, it was recommended to sexually active individuals or individuals that didn't know their hepatitis B status. But over the years, it became a recommendation to give to all newborns for general public health reasons. Reasons being that some people don't know that they have hepatitis B, and so maybe you could infect a baby by accident, and it's very rare. But that's the reason why they instituted it for all babies. The question really that a lot of parents have now, and I think it's a very reasonable question, is we have testing. We know if a mom has hepatitis B, and so do we really need to give every single baby a hepatitis B shot on day one of life for all babies? Do the benefits outweigh the risks? Medicine still says yes. They say, well, we look at hepatitis B and the rates have plummeted. So it certainly has been effective to that degree. But the question in my mind is, what are the risks? What are the long-term complications? And that's the discussion that's never had. And there's a lot of information there that we just don't know, because we just don't really know what the long-term risks are of any of the vaccines, really. We're not following them for a long time. And so that is the, I think, really important piece and the discussion that needs to be had. I think it's not unreasonable, because so many parents are confused and concerned giving a newborn baby a vaccine they don't feel like they need to. And we're starting pediatrics and we're starting as a doctor off from this place of distrust or from parents not really believing in the recommendations that we're making. And I think it's really important that we revisit those and have real discussions around whether that is something that we could maybe modify to say, look, you can get the hepatitis B vaccine if you want to at birth. You could, we recommend it if you have hepatitis B or someone in your family has hepatitis B, but for all of their kids, it's generally recommended to get it at some point in childhood, but not necessarily on day one. I don't think that's so controversial, but that's something that I think needs to be discussed because that's what many, many, many parents feel. And of all the vaccines, that's by far the one that people don't follow the recommendations the most. And I think that's a bad place to start in pediatrics. And I wonder, do we really need to give a newborn baby hepatitis B, and what are the side effects and the complications of that? I would think there are real risks to giving a baby, a one-day-old, a vaccine. And I don't know that we have anywhere near the appropriate research on safety that we should have to be giving a newborn baby a vaccine like this when you've tested negative as a parent.
Is it true that they also don't let you study, test the vaccines, on groups that take it and that don't take it?
So I wouldn't say that they don't allow it. I would just say that they haven't done it. Mm-hmm. So there really aren't vaccinated versus unvaccinated trials, which would be really important. I mean, these are things that should have been done originally, and they weren't. Nearly all of the pediatric vaccines on the schedule. So there's all this confusion about the word placebo and the testing that has actually occurred. And you have to understand the actual meaning of the word and the reality of the research to understand the nuance there. And every single vaccine has been placebo-controlled studied. They've all been studied against a placebo, but the placebo in almost all of the studies is another vaccine or the vaccine without the actual antigen in it. So like the rotavirus or the rotavirus part in it, but all the other stuff. So you don't get a baseline of safety, you get a relative safety. And so something like hepatitis B, it wasn't studied against a inert placebo or against unvaccinated kids. It was studied against a different vaccine or the other vaccines on the schedule. And so we're not really sure. We don't have that baseline to understand exactly what the safety risks are because you're studying apples to apples. You're studying two things that might cause a reaction, and that can hide the safety effects. So yes, it hasn't been done. I wouldn't say it's not allowed to be done. There are some ethical concerns now, theoretically, over not giving kids a vaccine because the argument is, well, if there's a vaccine that's been put on the market and it protects you, then you can't not give that to the children because that would be unethical. So you have to give them the standard. You could study it against that, but you can't give them nothing. And so we run into this conundrum because it wasn't studied against an inert placebo originally. So now you can't study it against inert placebo because that's unethical. So there's this weird circle that we now are sitting in where you can't do the studies which you really need to do to show the safety and what the actual safety profile is.
With the new administration, is that going to change?
I don't know. I think that I would say yes. I would say in general, there are going to be changes. There certainly are changes. What is going to change, where things are going to go, I think that's still very much up in the air. Vaccines are such a touchy subject, and so I think they're discussing it, but they're treading lightly, and they're kind of working their way through. I mean, they did say that RFK did say recently that he was going to placebo trial all vaccines. What that's going to mean, I don't know. What kind of pushback they're going to get from doing any changes is still unknown at this point. But I would say that at least there shouldn't be any controversy when you have a brand new vaccine that has no other vaccines on the market, that we shouldn't do the best possible safety research. We shouldn't have long-term trials, and it shouldn't be tested against an inert placebo. Nothing should be controversial about that. We should make that the standard, and that should be the standard going forward. What they're going to do about the vaccines that are already on the market, I think that's much more complicated, and that's going to involve a lot of nuance and discussion. I think they're going to discuss it. I think they're going to look into it. I think there's going to be a lot of discussion around exemptions and requirements and forcing people to do things. I don't know where that's going to end up, and it's still probably going to be state by state. But I do believe that there are a lot more discussions to come on vaccines, and that's a big issue that is a part of RFK's mindset, but he's not tackling that first, not fully.
Yeah, I feel like a lot of times it's the holding back the information that worries me as a parent, because I felt like in the hospital, it wasn't really like a recommendation. It was more like, we're going to do it this way. And you really have to like speak up for yourself if you don't want it that way. And if you just are there and you don't have many questions, they will just do all their things that they want to do. And I didn't really have that feeling of like having a choice.
Yeah. So for most things, you technically have a choice, but like what you're saying, I think is the issue is it's almost a routine at this point. And so unless you say something, they're just kind of going through their check boxes and you're doing this vaccine and this vaccine and this test and this test and this test. All right, get you out. And a part of that is good. I mean, a part of a routine is good in the fact that you want to make sure in medicine that you're following the best standards. You use the evidence that you have to make sure that all the nurses are doing the same thing, the doctors are doing the same thing, so that way you're not missing something on kids. But every kid's an individual. And so when you're just following a routine, then you're not actually thinking about the individual child. And I don't think that most parents who are not in this world of questioning things or thinking about medical freedom or even thinking about vaccines, they just don't think about it. They don't have any idea. And so they go in the hospital and they say, okay, you're going to get your RSV vaccine, you get your hepatitis B vaccine, you're going to get your vitamin K, we're going to give you an antibiotic ointment, and we're going to do a bunch of tests, and then we're going to send you home. And okay, great. And they don't think about what that could mean long term. And most people haven't. I mean, this hasn't been a discussion that we've had really ever. I mean, we have not talked about the risks and the complications of vaccines. We know the diseases. We know the risk from the diseases. We know what they can do to you. We know how many people get those diseases. We have a pretty good idea of how well the vaccines work, but I don't think we have a very good idea of the risks from the vaccines. And when we were so focused on vaccines 20, 30, 40, 50 years ago, or 60, 70 years ago, working on these things, infectious disease and death and serious complications from infections was a big concern. It's a much lower concern now. And so most parents are seeing autism and ADHD and autoimmune conditions and chronic disease, and they're not really seeing these diseases. And the balance has shifted. And maybe that's because of the way we're living that's different, or maybe because the vaccines have worked for the most part. And so we're not seeing some of these diseases as much, depends on what you believe. But either way, we're not seeing as many of these diseases. And so that risk balance shifts. And it's a reasonable thing now to sit here and say, okay, I know that the whooping cough vaccine protects me from whooping cough, but at what cost? Do I want to take the risk of having whooping cough, or are there some side effects? Does it increase my risk for autism? Does it increase my risk for autoimmune condition? And then if so, what is that risk? You want to be able to weigh those two things, because just because you have a vaccine doesn't mean that you want to increase your risk to get asthma. So you have to weigh those two things, and that's never been done. We don't have long-term research on how these vaccines are affecting chronic disease, and even if they are, they just say that they're not, but there's a lot of conflicting research out there, and so it's really not definitive. And especially it's not definitive because we haven't done prospective trials following kids for a long time who are vaccinated versus unvaccinated. So we have no idea what the difference is in chronic disease between vaccinated kids and unvaccinated kids, which you need to know. That's an important piece of information to help a parent to make a decision of whether they want to inject 20, 30 things into their kids. What does that do to them long term? Just because it protects you from those diseases, what's the cost for that? If you're just to give your kid a pill, imagine a magic pill. Okay, your kid's never going to get sick, no side effects, never going to get a disease in their whole life. Okay, that's great. I mean, give your kid the pill, wonderful. But that's not the reality of the world, right? The reality is, what are the risks from doing something? You can't just say that it's safe and effective all the time. There's risks to everything.
So in your book, do you show the side effects of the vaccines? Yeah,
I mean, I talk about all the vaccines. So, the first part of the book, we go through the history of vaccines, and then I talk about each of the vaccines and kind of that first part, like what are the risks of the diseases, what are the risks, how do the vaccines work? And then, we get into the big questions that people have, what are the known risks, and the discussion around some of these things. But it's very hard to know what the risks are without having the proper research. So I can't tell you. I don't know. I mean, that's a big issue for a lot of these things, and a big issue in the office is I don't actually know, because it depends what you look at. I mean, for example, the easiest example would be something like asthma, allergies, and eczema. Really common in kids these days. Mm-hmm. And depending on what resource you look at a mainstream CDC kind of book, or someone who really follows the mainstream CDC, and they'll say, no, vaccines don't have anything to do with that. There's no risk. It doesn't increase your risk of asthma. It doesn't increase your risk of eczema. But if you look at another book like from Neil Miller, who has all sorts of great studies from in great journals, you can see a whole other world of studies that show maybe there are some risks. Maybe some of these studies do show an increased risk of asthma, eczema, allergies. And so it's hard to know what's true. And until you get the proper studies prospectively to follow kids forward, we don't actually know what's true. We just have some good studies over here and some good studies over here, and what's right and what's correct about that. And I think that's an important piece that we're missing. I think it's the most important piece if we want to understand what the risk profile from these products are.
Can we at least say that vaccines are not safe and effective?
We can say they're not perfectly safe and effective, for sure. I mean, nothing is perfectly safe and nothing's perfectly effective. And that sentence doesn't make any sense. I mean, that's propaganda. Safe and effective doesn't mean anything, right? This doesn't really mean anything because nothing's 100% safe, nothing's 100% effective, and nothing comes without risk. And so the question is, what are those risks? What is the safety? How much does it prevent? Like, these are the things we need to be asking, and you can't just make a blanket statement. And that's what happened during COVID, right? That's where I think the medical establishment lost most of its credibility because they kept saying safe and effective, safe and effective. And you can't possibly know something is safe if it's new. You just can't know that. You could say, based on the research that we have, the benefits seem to outweigh the risks in the short term. We don't know anything about long-term risks, but we recommend this product because we feel like it, based on the research, it decreases your risk of death, decreases your risk of hospitalization, and we haven't found any major risks that we've seen yet. Like that's honest. It could be right or wrong, but it's honest. But if you say something's safe and you hasn't been around for a few years, you don't know if you're going to grow another toe, another eye. Like, you don't know what's going to happen. Anything could happen. So you can't say that something's completely safe. It just doesn't make any sense. And that seems to be the mentality of healthcare right now, which is these things are perfect. They never cause a problem. And you're asking a question about vaccines. You're an anti-vaxxer. You're crazy. And that's not a good place to be. And I think that's where so many people have lost their respect for medicine and their trust in medicine because they don't believe that doctors are being honest. They don't believe that healthcare is being honest and truthful with the information that they have, because we really just don't know a lot of this stuff. Even though we say that we do, the research isn't actually show that when you look at it.
Do you understand that where the unvaxxers are coming from after COVID?
Oh, yeah. I mean, I've understood where the anti-vaxxers are coming from a long time, but I think that COVID really brought it out, and it was something that we lived through. And so we saw a new disease. We saw a new vaccine. We saw a campaign to get that vaccine. We saw the information around. We were young when a lot of these vaccines came out. So I don't think we saw it. You just got it when you were a kid, and then for most adults, you don't think about it anymore. But now you watched this campaign, and then it makes you wonder, okay, if that's what they're saying about this, what are they saying about everything else? And that's what pushed me over the edge. I mean, there are many things, but that's certainly one of the big things to really look into this, because I've been getting so many questions, and I don't have the answers to those questions, and I wanted to know what research is out there. And it's not more clear than anywhere than looking at the autism research. I mean, it's insane when you go look at the autism research, and what are we taught in medicine? We're taught it's settled. The science is settled. Autism has nothing to do with vaccines. And when you look at the actual research on autism with vaccines, it's almost non-existent. It doesn't even make any sense. Like, the only research on autism with vaccines is on MMR and thimerosal, which is the mercury component of vaccines, which isn't even in vaccines anymore for the most part. I mean, it's in the multi-dose flu, but not the other vaccines. So how can you possibly say that vaccines don't have anything to do with autism when you haven't studied it for all the other vaccines? It blows your mind.
So in the multi vaccines, there's still mercury in them?
So in the multi-dose flu, which it's not really given here that much, they pulled it out of all the other vaccines. So it's still in the multi-dose flu, but not in the single-dose flus. But everything else doesn't have that in there. But the research is on that, which isn't super relevant anymore, and then MMR. And that's it. So how can you say that all vaccines don't cause autism when you haven't studied all vaccines? You get MMR at 1. You get all sorts of other vaccines before 1. You get hepatitis B, and polio, and DTaP, and pneumococcus, and rotavirus. You can get RSV, you get flu shots, you get COVID shots. So how can you say anything about autism and vaccines if you don't study all of those things? it just doesn't make any sense. It doesn't mean that vaccines do cause autism. You'd have to have research to show that. But you certainly can't say it doesn't cause it. It's a ridiculous thing to say when you look at the research.
So you looked into it and there was just non-existent?
It's non-existent. And so when I was writing the book, here's what I thought I was going to find about the autism research. I've always been taught, and everyone in medicine has been taught, that the science is settled. So you assume that that's true. You assume you should be able to believe the CDC. I mean, back then, you assume you should be able to believe the bigger organizations. You assume that you should be able to believe what you're taught. And if somebody says so definitively, and you hear it over and over again, that the science is settled, that there's so much research, you assume that that's true. And so I assumed that when I was going to be doing this section, there would be a big body of research that would show that vaccines don't cause autism. All these good studies that look at vaccinated versus unvaccinated versus all the different vaccines and showed there's no risk. So that's what the majority of research would find, but there would probably be some other research that showed, because I know some of the studies that show, maybe there is some relationship, maybe in some of the studies they do find a relationship between vaccines and autism. And so I wanted to show, both those sides, but at the end of the day, you would say, well, the reason why medicine says this is because the evidence is very overwhelming over here that vaccines don't cause autism, but I don't think we should say that it's so definitive. There are some studies that show vaccines maybe are related, so I think we should keep researching. But when you actually look at it, you definitely cannot say that. There's no research to show that vaccines don't cause autism. Nothing. It doesn't exist, which is insane.
Well, maybe it's for a reason.
Well, maybe. I mean, I don't know. I don't know what the reason is. I can only think of one reason. Yeah. But it's absurd that there would be no studies whatsoever. And I was so shocked that I thought I had to be missing something. Like, I didn't understand how it couldn't be there. I did a master's in epidemiology, so I've done health research. I actually did a literature review many years ago. So I have a decent idea of how to look at the research and how to go through the internet to kind of find the studies. But when I was doing that, I was like, this can't be all. Like, I have to be missing something. So I got a bunch of books, read those books, especially like very pro-vaccine books. And things by Paul Offit and Peter Hotez, and looked at their citations, and they don't have any different citations than what I have. So if there were some amazing studies that showed that vaccines don't cause autism, they would surely have them in their books, and you would think it'd be like front page news of the New York Times if they had some big study that showed that vaccines don't cause autism, other than the ones that they have. So I don't think anything more exists. And I don't know how you can make statements when you just look at one vaccine. And most of those studies on the MMR are kids that got the MMR versus kids that didn't get MMR in the setting of getting all their other vaccines. So every study, the kids are getting vaccines. So where is the research that shows that vaccines don't cause autism? It doesn't exist. So, and again, it doesn't mean that they do. I'm just saying you would need to do the proper research to say one way or another. We haven't done that research yet.
And maybe it seems like it's not an accident that there's nothing there.
That's the only conclusion that I can draw from that is I can't imagine that nobody has looked into the big databases that already exist and not looked at, all right, well, let's see how many kids have autism that are vaccinated versus unvaccinated. Let's see how many vaccines they've got and what their rates of these things are. It would take 5 minutes to do it. To do those, obviously, the study takes longer, but to look at that statistics is really quite simple as long as you have the database. So either nobody looked because they just didn't want to find what they found, or they looked and they didn't like what they found and they just let it be and didn't publish any studies on it. I don't know. I don't know what has happened in the background. I don't know. I don't want to say anything that I don't know. All I know is that it hasn't been done and it makes no sense. So you can draw your own conclusions from that.
While you were writing your book, did you have another development where you're like, oh my God, I didn't expect this to be that way? Or was autism the biggest one?
Autism by far the biggest one. Yeah. I mean, that is so big because it's so definitive. I think, to me, and I hope over the next few months that this discussion gets had more and more and on bigger platforms, and people like continue that you're willing to talk to me and other people are willing to talk about this, that we have these discussions and other people have these discussions, because I don't think doctors know. And I think the bridge to moving forward on vaccines is the autism research, because any doctor who actually saw the research would be like, what? Like, there's no way that doctors know, because I didn't know. And I'm an integrative doctor. And so people come with these questions, and people just assume that what they're told is true. If they were to look at what the actual research says, I don't think any doctor would say vaccines don't cause autism anymore. I think they would say, we need more research. We haven't done the proper research yet.
So there's no research to prove if you say vaccines do cause autism against that argument?
There's not definitive proof. I mean, there are a few studies here and there, not great studies for the most part. There are some studies that show some correlation, some increase. So there are a few things that do, but none of them are really, really good studies that are high quality, that are big. And realistically, regardless, you have to do a prospective trial following kids to have any sort of real ability to discuss this. So there are a few little studies out there for sure, but not a lot. There's really not a lot. It's surprising.
It's just crazy because I think like with makeup, they don't even want it being tried out on animals. And it seems like with vaccines, you're kind of like experimenting with newborns and nobody really knows the effects, right? Which is like crazy.
Yeah. You're asking, what's the other crazy revelations? And I think that's the other big one. I mean, not as big maybe as autism, but the reality of what the research actually has been pre-licensure on some of these vaccines, it's really startling. Like some of the safety trials are just a few days. Some of them, maybe a couple months, if you're lucky, 6 months to a year. So yeah, we're experimenting on kids in a way by doing these trials, but then you put in the population and you have no real idea what it does to you long term at all. Even in the best case scenario, if you do a really good trial, you're probably not following kids for 10 or 20 years because otherwise you're never going to have products on the market. So it is an experiment to some degree on your kids, because if you haven't studied something for 10 years, you don't know what it does to you for 10 years. And now we have this explosion of chronic disease. And the logical question is, okay, why? Why do so many kids have all of these conditions? And if we're talking about vaccines, is any or all of the vaccines related to some of that chronic disease? I mean, maybe not. Maybe it's just the food and the way that we're living. Maybe vaccines don't have anything to do with that. But it's not unreasonable to ask that question. And when you haven't studied these things for several years, how do we know? We have an explosion of childhood cancer. Vaccines are not studied for cancer. So how do we know if they're related to it or not? You can't say that they are, but you certainly can't say that it's not. Shouldn't we be studying these things for these issues? Shouldn't we follow kids forward for 10 or 20 years? Even if the thing gets on the market, shouldn't you still follow those kids for a long time? I mean, we have to figure out a way to do that moving forward, or we're giving all these pharmaceutical companies all the power. They just do these quick trials, show somehow that it works and there aren't risks, and then, okay, well, let's just give it to everybody.
But besides COVID, all the other vaccines could have been followed around for 10 years.
Could have been.
Right? Because COVID is like 3 years old, but everything else is like 50 years of vaccination.
So, I mean, yes and no. There's nuance there, because if you're going to make every vaccine go for a 10, 20-year trial before being on the market, then it would take you 10 or 20 years before you're ever going to get anything new on the market again. And so you want to have some balance there between safety and actually completing projects, because what pharmaceutical company's gonna be like, all right, I'm gonna study this for the next 20 years and pay all this money and maybe it doesn't work out, right? So I think there's a nuance there, some sort of middle ground, but we can't just allow pharmaceutical companies to study things for a couple weeks or a couple months and the company who stands to benefit to do the research and then to take their word for the research and then to inject it into every single child. We have to have stronger safety standards, independent studies, follow-up research, following some kids forward. All this stuff needs to be instituted moving forward to make sure that we're doing things that are safe. And there's a big difference, I think, between adding something onto the schedule for some sort of disease that's out there but not an immediate pandemic. Like, I think in a setting of a really bad pandemic is very different than just adding a general vaccine out there. And so I think we need kind of two standards, because if there is some sort of horrible disease that comes out, you don't necessarily want them to have to wait 10 years to get out there. I mean, imagine there's an Ebola outbreak and 9 out of 10 people are dying. Like, maybe you're being willing to take your risk for the new vaccine, but that's a different situation. I mean, we have to have both options available, but it comes down to choice. You should be able to choose to take a new vaccine if you want to, but you shouldn't be forced to.
How is it as a pediatrician to watch parents decide to inject their child with like 50 different vaccines?
I mean, I try to stay impartial. I mean, I don't think it's my job to judge anything. And I think that I'm doing what I can to have discussions around vaccines. The standard of care is to do vaccines. And so I don't think it's my place to tell people what to do. I think that it's important to have those discussions and let people make decisions that's right for them. I mean, I've never seen any horrible reaction of all the things that you certainly read about. I've seen patients after the fact that have come to my office that swear by it. I've read and talked to many people that swear by their vaccine reactions. So I'm 100% confident it happens. I've never seen it. I think it's rare, but the big question about how frequent something is to me is what is the relationship to chronic disease? Because if vaccines are truly related to autism or they are truly related to eczema or any of these things, then injury is really common. If it's not, then it's maybe not so common. And so I think that's a big question mark, but I don't know the answer to that yet. So to replace somebody's thoughts about doing vaccines versus not, I think we need the other information first, because they certainly do some good too. I mean, there's some benefit to vaccines as well. The question again is at what cost? And I don't know that yet. I don't think anybody does.
What are the benefits?
The benefits would be the reduction of the diseases that you're vaccinating for.
But aren't most diseases not around anymore? Or can't kill you, like the whooping cough?
It can kill you. I mean, a baby just died from it. So the answer to your question is that the majority of the diseases are rare now. And most of the time when you get it, it's not that serious. But it could be. I mean, if you take flu, I mean, tens of thousands of people die from flu every year. Pneumococcus is around. Haemophilus is around. People die from whooping cough. A couple of people die from measles, this year. So it's not an extreme risk, but it's certainly there. And very, very few people that actually get these diseases have not been vaccinated. So mostly they work. I mean, it's usually people that are unvaccinated. Whooping cough is the one that I would say that a lot of people still get whooping cough even if they get that vaccine. It's not a great vaccine in terms of preventing whooping cough, but it does prevent tetanus. Measles vaccine works really well at preventing measles. So they do have some benefit. And there's a difficult part of vaccines in that as of right now, you're pretty much right. Like if you don't get vaccinated, you're probably not going to get these things. I think the tougher ethical question, the tougher conundrum is more of a public health one. If everybody stops vaccinating or a lot of people stop vaccinating, then do these diseases start to come back? And then does your risk of these diseases increase? So I think that's a tougher question for the future, depending on where things go. As of right now, the risk is probably pretty low, given these things are super rare. It's not zero, but it's low. But what happens if a lot of people stop getting the measles vaccine? Well, we're going to have more measles outbreaks, and then you have more chance to get measles. And if you have more chance to get measles, then your risk of getting really sick increases. It's not a huge risk for measles. Most people do fine, but a couple kids died. So it's possible.
Is it unconstitutional to be forced to take vaccines, you think?
I think it's a very good question. I think it depends on how you define discrimination. Right? I mean, the discrimination laws, as they currently are like about race and religion. Health is not necessarily considered under that, but I would argue that it probably should be. I don't think you should be discriminated against based on your health choices. And there is certainly some precedent for that. So it's not been challenged in that way yet, but COVID didn't happen. So now it's been challenged a lot more. And for the most part, I mean, we've seen most people that were forced to do it, they won their cases. And so I think there's a good argument to be made that it's discrimination, whether it's the Constitution or not, but it's discrimination to not provide care based on somebody's medical choices. So I think there's a lot more to be had there from a legal standpoint. And I don't think that's necessarily unreasonable because, again, it goes back to you should be able to make your own choices. We let Jehovah's Witness choose not to get blood, even though you know that it might be able to save their life in that kind of situation. That's a choice that people are allowed to make. You're allowed to choose chemotherapy or not get chemotherapy. You're allowed to choose if you want to get a surgery for your heart or you want to get a pacemaker put in. Like, we don't force people to do it, even though medicine says it might benefit you. if you choose not to want to do it, then we allow that. But for vaccines, we don't. So it really is a double standard, I think, from what we do with everything else. And I just don't think that we should be forcing people to do vaccines. I think people should do vaccines because they want to, because they believe that it's a benefit for them. They believe that it's going to protect them from disease, and they believe that the risks don't outweigh the benefits, and so they want to do it. That's what medicine should be striving for. And then people can choose whether they want to. Whoever wants to do vaccines should be convincing other people to get vaccines based on the research, based on the data. And then people can choose whether they agree with that or not. That's how we do everything else.
Because here in California, it's like you can't put your kid to school. And as soon as you enter a school, they will ask, like, they always want an updated vaccine note from the doctor. Otherwise, you can't so you kind of like get forced. Otherwise, you got to have your kid at home.
Yeah, so it's kind of like COVID. It's forced but not forced. They say, oh no, you don't have to, but then you can't go to your job. You don't have to, but you can't have your kid to school. So it's not a full-on force, but basically, if you want your kid to go to school, then you have to. So yeah, I mean, again, I think it's discrimination on some levels for sure, and even in California, there's now precedent. The UC system was sued about taking away religious exemptions just last year, and they were forced to put them back. So I don't know. I don't know what's to come. I think there's going to be more lawsuits, and I think based on what I've seen and based on the outcomes of the other cases, that if the right cases get put in front of the courts, that religious freedom will come back and people will be able to choose whether they want to vaccinate or not. But currently, many states, a certain number of states, California, New York, Hawaii, a few places, have very strict rules of requiring vaccines. And I think it doesn't need to be that way. Many states don't require it. You can get exemptions, and still most kids go and do it. And I think that's the way it always was. And it wasn't like we were having massive outbreaks of disease or anything like that 15 years ago. And people were able to choose back then. So I feel like it might go back in that direction, but it's hard to know.
With your book, you said that most things are like centered. But would you say that just looking into these things, there are so many things we don't know that at the end of the day, only ignorance will make you take all the vaccines, and there's more hesitation, especially like after reading your book, there must be some sort of like hesitance where you treat the topic with a little bit more respect than just trusting the science because it's settled, right? Because you see that it's actually not settled, and there's many like question marks. The studies are not there, the proof is not there. They don't really do what they say they do, and there's so many red flags that after looking into it more, you're like, well, I don't know anymore now. At least I want to like go it on slow compared to the crazy CDC schedule.
I would say that's still balanced, though. I hear what you're saying, and I think that, and I said this in the book, if the information makes you hesitant, that's not me, that's the information, right? You have to take the information as what it is. You have to take the science and the research to what it is and what does and doesn't exist. I can't make the research be any different. To me, balance is presenting both sides, presenting the information that somebody who's trying to push you to get a vaccine would say, and presenting the information to someone that's pushing you against having a vaccine would say, letting you see both those things, letting you see what information exists so that you can make a decision. Now, if seeing information that is inconclusive makes you decide that you want more information, that's balance. That's the way that it should be, because that should lead to questions which would lead to research. That is what my goal is. It's not to get people to vaccinate or not to vaccinate. It's to get people to understand what's out there, to question just being told, or just do it just because. I don't think we move forward until people understand what the research is. So to me, that's balance. If that leans towards hesitancy, that may be the way that it is. Probably the way that it is, because all that we get presented in general is just the rose-colored, everything's perfect about vaccines, and that's not the reality of the world. But that's still balanced in my mind. That's showing both sides, and I showed the positive sides. I mean, the whole beginning of the book, not the whole beginning, but like the section on the vaccine, it shows the diseases. It goes through the history. It goes through the efficacy of the vaccine. So I mean, there is some benefits, and I go through some of the stories explaining some of the kids that have died for some of these things. Like, I think it's kind of like a tennis match in some ways, where you would think that oh, I'm so this way, but then you read something about it, like, oh, okay, I see the other side's perspective. My wife's a lawyer, right? And she does a lot of mediations. And I think this is a mediation in a way. It's like kind of showing you both sides a little bit. And even someone who's very, very anti-vax, I think is really useful to read the other side's perspective to kind of see where both are coming from. Because I do think right now that no one wants to see the other side's perspective. They get very ingrained in their kind of team, and vaccines are the worst thing ever, or vaccines are the best thing ever. And it's important to know what the other people think, what the doctors think, why the doctors are pushing this, why the doctors believe in it, where that belief is coming from, how the pharmaceutical companies play into all this. I think all those things are important to understand the landscape, so that way you can have a better understanding of where everybody else is coming from. Not so that you will change your opinion, but so you understand where they're coming from. So that's where I think it's balanced in that way.
Is there like a line where you like the COVID vaccine where you like, nah, for like pregnant and like children, like there's a no, like that shouldn't be recommended anymore. Is there something else like what you said about the whooping cough vaccine? It's just not very effective.
Yeah, there are a few. I mean, look, my personal opinion is my personal opinion. What the CDC says is what the CDC says. I can't say to do something other than what the CDC says. They have to change it. They're the authoritative body. People can make their own decisions to change things. I think the COVID vaccine, it doesn't make a lot of sense for kids. Certainly doesn't anymore, or maybe never did. I think that.
Is it still on the schedule?
So it's still on the schedule as of right now. I think that's about to change. That I do think is changing. I know they're meeting about it, and I'm pretty sure they're going to pull the recommendation for that and just make it optional. We're really the only place that does have it as a recommendation. Almost everywhere else in the world doesn't. So that's why I feel comfortable that it just doesn't make a lot of sense to promote something that has very minimal benefits and certainly some risks. We know that there are risks to the COVID vaccine, and especially with younger kids, they're at a very low risk. They're a very low risk group. So to have that on the regular schedule just doesn't make a lot of sense, especially when nobody else in the rest of the world does. I think if you want to get it, if you're high risk, go for it. Do whatever you want to do. But it just doesn't make a ton of sense. Hepatitis B, same thing that we talked about before. I don't think that makes a ton of sense to be a blanket vaccine for all one-day-old babies. That doesn't make a lot of sense to me. I think we can have some nuance there. And I think if we did have some nuance there, it would give people a lot of confidence in the leadership, having some common sense. Which doesn't seem to be the case these days. The polio vaccine, I think we haven't seen polio in a very long time, so that could certainly be something that was discussed to push it back later, to get one of the vaccines out from younger kids. Obviously, if polio starts coming back, that would be different, but we haven't had a wild polio case in decades, so it's not necessarily something you have to give to all 2-month-old kids. Measles vaccine at 1. That may be something we can discuss. Many countries do it at an older age. So that could be something that could be offered at 1, but maybe, kids are, even if it's not related to autism, I think there is far and above more concern about MMR and autism than any other vaccine. And so even out of caution, you could say, well, we know there's some concern about it, so we're recommending it at 18 months now or 2 years or whatever it is that they decide. Other countries do that. Not every country does it at 12 months. Lots do it at 18 months or older. And so I think it comes with a little humility that we're not the only place. We're not the only way. Let's see what other places do. Let's listen to parents' concerns, and maybe we can make some adjustments based on what we're seeing today, based on what's more common, what's less common, and let's decrease the schedule for so many vaccines for a really young kid, and maybe push some of them back a little later when the child's more developed. I think parents would see that as a move towards safety and towards thinking about some of these complications, and that's the first step towards bridging that gap, maybe. Just some discussion around, well, we're just not going to do more. We're going to think about what do we really need. Let's prioritize what we really feel that we need, and then let's focus on those, and then the rest, we'll discuss those things.
What is the criticism from your colleagues?
I don't know. We'll see.
Have you had any?
I mean, I've talked to several doctors. I've showed some of them the book. So far, everyone's been very positive about it. When and if people kind of just see things randomly, I don't know. We'll see. It's hard because the problem with this is that it's an echo chamber. The stuff that I'm able to get on in general, the people that listen to it are more, I guess, more health conscious, more open to these kind of discussions. And it's not like I'm getting invited onto The View or something like that, where it's the other side. So I don't even know that most doctors would even know about the book, right? I think that if it gets more popular as it comes out, and if more things are willing to have discussion, especially on the liberal side or whatever you want to call the other other media, then that might be more interesting to see. I've tried to talk to some doctors, and I'm trying to set up things moving forward, but most don't want to talk about it. So I think they're just not willing to have conversations. I hope that changes, and I have a feeling it might because of RFK. Because I was just talking to Del Bigtree, and I was asking him, like, I think that the thing that needs to happen right now is RFK and others like him and Del Bigtree, they need to get out there and talk to doctors. They need to have conversations with them. They need to hear their concerns. They need to have debates and discussions. And his response, and I know this, but his response was, well, they've wanted to do that before and doctors never want to do it. And I said, yes, but it's a different time now. There's a different social media. Things don't get shut down. And when you're the head of the HHS, people I feel like are going to be forced to talk to him, because it's either RFK's narrative and they're going to debate it, or they're just going to let it be the only narrative. And I don't think they're going to. So I'm hopeful that people are going to be more open to having discussions about this because they have no choice.
How much do you think can be done against Big Pharma with the movement, like MAHA movement?
I think a lot can be done. I think that people have all the power at the end of the day. So I think that for many of these things, we can make huge changes. It's not going to be everything, and it's not going to be everything all at once. But I certainly think if people want change, it can be made over the next decade or 2 decades. I mean, we have all sorts of problems. We're not going to fix it in 2 weeks. But over the next 5 or 10 years, if the guideposts change and we're looking towards health, then we can do that. And companies want to make money at the end of the day. So people are going to stop buying their products. They're not going to want to make those things. And I still think there's plenty of money to be had while still doing things in a safer, better way with a different focus. So yeah, I think there's a lot that can be done. I think there's going to be a lot of change in vaccines. There's going to be a lot of change in medication. There's going to be a lot of change in lifestyle, a lot of changes in food, because we have no choice. Like, we really have no choice at this point. People are so sick. Many people had reactions to the COVID vaccine, so they're awake to the realities of concerns around vaccines. People are more hesitant than they've ever been. So people are open to having these discussions, and I think there's a momentum there that can't be undone easily. And I think we're seeing a lot of changes. I can't believe how much has changed in just a few months. So yeah, I think there's going to be big changes. I think there's a patience with it. I think certainly with vaccines, that's a big topic, and it's going to take a lot of discussion and understanding and debate and bringing in the entire medical community, which is not going to be quick or easy, but it certainly is possible. And I think it's possible because everybody wants healthy kids. We might not agree on how to get there right now, but we want the same thing. Everybody wants healthy kids. And so I think at the end of the day, if you can build that case and you can build the research and the data, you can have everyone, or most people, behind it.
What are the changes that have happened so far?
What changes have happened so far? Well, there have been discussions about health like there's never been before. It's been a part of the discourse from the election and on. You have an entire MAHA movement of people that have taken over all the health positions, and it's really weird. You have people like RFK and Del Bigtree who were seen as most fringe a year ago, and now they're in charge. You have Jay Bhattacharya in charge of the NIH. You have Marty Makary, who's in charge of FDA. You have Vinay Prasad, who's head of vaccines now. Dr. Oz. So all people that are questioners, people who have concerns about the way that things are and are there because they want to see change. So that's happened. We've seen changes in the food dyes already, and just the discussions around that. The push towards getting synthetic food dyes out, approval of some natural food dyes already. Some companies have already expressed that they're going to voluntarily make those changes. There's been all sorts of laws passed in different states for all sorts of different things around food. Some states are getting junk food out of kids' lunches. Some places are getting food dyes out. In California, taking the food dyes out of lunches. They're building a definition of ultra-processed foods, aiming to get ultra-processed foods out of kids' lunches. There's discussions around getting fluoride out of the water. And what else? I mean, there's just that's a lot for only a few months. Like there a lot of stuff has actually happened. Oh, and the drug prices. Discussions is just recent, but that they're going to be slashing the drug prices and making sure that we're competitive with the rest of the world. I mean, these are big changes for just a few weeks or just a few months. So I think that's happening. I know that it's going to take time to build a team and to move people forward, and all these changes take time, but it's certainly happening. So I don't know. I'm very encouraged that we're moving in a better direction, and I think that as people start to realize that the people that are running this are not there to cause evil, but they're there to try to help. You may not agree with everything they say. You might not agree with that much of what they say, but they at least have a motivation that they feel like is going to move us forward. And I hope that the more of that people find that they're able to do and make change, and the more they're going to get behind it. And I hope that instead of all this division, we kind of rally around health, and we don't have to agree exactly on the way to get there, but people can still team up, and Democrats and Republicans can try to out-Maha each other. That's fine. I mean, I don't understand how the Democrats just gave up health during the elections, just kind of let the Republicans take it over. And all these people that were Democrats originally kind of switched teams around health. And that doesn't make any sense because classically the Liberal Party has been much more about that. And I would hope that is going to be something that they learn their lesson about and start to fight back in terms of trying to out health Maha. They don't agree with something that RFK does. All right, well, you do it in your states and do it better. And if you do a better job, great. Or team up, or say why you don't like something and do it, or join the discussion and do it bipartisan. I mean, that would be nice, right? Like there are many things that don't have to be controversial with health. It could just be a discussion, and we're going to move forward based on the best research. So I hope that happens.
Do you think these changes would have happened under Kamala Harris?
Probably not. Maybe some, but most likely not. I mean, because it's not Kamala Harris, right? It's the team.
Yeah.
Yeah.
I mean, under the team.
Yeah. I mean, I don't think it would happen under Trump either, right? I think it happening under Trump with the people he's selecting that have a vision for what they want health to be, and they're choosing people around them that share that vision, and so it's moving it in that direction. And I don't know, maybe this is going to be a terrible direction and it's not going to be good. Who knows? Or we haven't seen where it's going, but to me, it seems like a great direction, and it seems like the direction we were going was not wonderful, and so the changes, I think, are going to be a far net positive, but we'll see. It's very early on. But I think if Trump gets in there and doesn't appoint RFK, you wouldn't see most of this stuff happening because you'd still have the status quo. I think a lot of people in the political world, it doesn't matter which team they're on, they're still on team money. So whoever's giving them the most money, whichever pharmaceutical companies are paying them, they're gonna bow to those whims. So I think that you have a team of individuals that seem to be more unbiased and more, I guess they're not as bought, it seems like. So they're doing what they think is right, and you may agree or disagree, but it doesn't seem like they're doing it because of what they're being paid to do. It seems like they're doing what they think is going to be the best.
Yeah, when it comes to health, it shouldn't really be about any party.
No, it shouldn't. But I mean, in a way, I'm very glad that it got to become a part of this election because it brought health out like it never had before. I hope it goes back and is no longer political because it shouldn't be. These are things that have to be bipartisan because it doesn't matter if you're a Republican kid or a liberal kid. I mean, you're a kid. And we don't want any kids to have cancer or to have an autoimmune condition. We want people to be healthy. So it doesn't really matter what side you're on. We need the politics in terms of the rules and the regulations and the laws. That's where it comes in. But it would be nice if we could do it together.
What is the main purpose of your new book, you would say?
The main purpose is to foster discussion around vaccines, to bring the word vaccine out from the shadows and to allow people to start having conversations, to see what the research actually shows, and to begin debate. And there have been multiple books over the last year in the health world, whether it's Jonathan Haidt's book and cell phones, Casey and Callie Means, and metabolic health. And I hope this book in vaccines, just to bring that discussion to the forefront, not to tell you what to do, but to open your eyes to what's out there and then allow conversations like this to be had. This would have never been possible. I mean, we could have done it, but it would have just been censored a year ago. And in the last few months, I've been on all sorts of great podcasts, and people are willing to post about it and willing to talk about it. And I hope that continues. And I think that the more that we do this, the more that people feel comfortable talking about it. And then it doesn't have to be taboo anymore. Like, there's no reason why you shouldn't be able to have a discussion around vaccines. You're injecting this thing into your kid. Why should it be censored? If you're concerned about it, why shouldn't you be concerned about it? You're injecting things into your kids. You should want to make sure that it's safe. Why would that be crazy? Why would that make you anti-vax? It doesn't mean you don't do it, but why wouldn't you question it? You'd question a medication and give your kids. You should question it.
So it does. If it doesn't give you the answers, it should fire you up to question the vaccines?
It should fire up to question everything, but it should certainly fire up to ask questions of your doctor and ask questions of what you know about vaccines, or at least the fact that you don't know everything, and we shouldn't just take things as face value. So I think it fires people up to realize that there's more to this story, and we need a lot more. And the only way we're going to get there, I think that the only way that doctors are going to turn is if enough parents start to ask questions. Doctors can't hide if every single patient has questions for their doctor, and they can't just kick everybody out, right? And I think that's what's been happening. There's been a gradual shift over the last few years, I think, to questioning vaccines more. I mean, the numbers don't lie; they certainly show that. But as of right now, if you question vaccines, doctors can just kick you out. And that seems to be the way that things are. I mean, everybody should be able to take care of whoever they want to. That's business. But at the end of the day, you shouldn't be discriminating, I think, against people, their vaccine choices versus not. But do you really want a doctor that, if you don't want to do vaccines, you don't really want a doctor that wants to force you to do it anyways, right? So I think it goes both ways. But I think that we are at a place where we need people to ask these questions, so that way the doctors start to ask those questions. Because if every patient has questions and every patient has concerns, the doctor is going to start to wonder why. If people don't ask questions and just 99% of people do whatever they say, they're never going to be forced to look into it. They're never going to be able to force to question it. And a lot of my questioning comes from the questions I got from families. It really does. I mean, you get asked questions you don't really know the answers to, and then you look it up. And when you look it up, you're like, okay. Or it pushed me to the point to write a book, because I really felt like it was important to have it. I mean, I read enough books. I didn't have a good resource that was in the middle that could help parents that are trying to decide whether they should vaccinate or not, which is where I think this book really comes in especially handy for those parents that are like, all right, well, you know, my parents are telling me to vaccinate. I have some questions. I don't know. My spouse is more holistic minded. They don't want to do it, but I kind of want to do it. I mean, that's the way that most families are. They're like, I probably want to do vaccines, but I heard my friend's kid got autism, and my cousin's kid has asthma, and the first kid has an autoimmune condition. I'm like, I don't know. I keep hearing the vaccines could be related. Do I do the vaccines for this kid? Is it related? That's almost everybody now. Everyone's there. Like, you're either hardcore on one side, that's the minority, or most people are somewhere in the middle, and that's what I see every day. And so I wanted something for those people to kind of walk them through.
Is it really 1 in like 23 kids at this point?
For autism?
Mm-hmm.
It is 1 in 12.5 boys in California.
Yeah.
1 in 31 now.
Do you see that at your office?
We have a little bit of autism. Certainly not those numbers. I have a number of kids with autism that came to the practice after because they have autism. But if I'm taking the numbers from the kids that are born in my practice, it's not anywhere near that. It's not 0, but it's certainly not 1 in 12.5 boys. I don't know what the numbers are specifically because I haven't looked, but it's 1 in 100 maybe.
Could that be to the fact that you're more in the middle and not like telling every patient to just if they're not taking it, they're risking their kid's life? Because that was like my pediatrician was like, you're risking like your baby's health.
I think it's that lifestyle that makes the difference. I think the lifestyle of questioning and the lifestyle of health. And where the vaccines play into that, I'm still not sure. I've taken care of kids with autism that never had a vaccine, so I know for sure it's not the only thing that can cause autism. I think autism's probably many things. I think vaccines are probably one piece of the puzzle for chronic conditions, amongst many things. But I would venture to say that the individuals who are health conscious, who think about what they're consuming, think about what they're eating, think about where they live, think about being in nature, community, sunlight, all those things factor in to those diagnoses. And so that's probably the reason, because if you're coming to an integrative medical practice, you're Googling integrative medical doctor, or you're asking a friend or whatever it is. So you already have some sort of mindset about health in some way. And I think that's what makes a difference. The biggest one.
Yeah. Yeah, because it's very unlikely that they don't do any vaccines, but then they eat really, really healthy and spend all day outside and then take all the vaccines at their doctors, right? It's normally that if you're already health conscious, you eat the right foods and you don't take the vaccines.
I think that's more common.
Yeah,
yeah. I wouldn't say that no families who are extremely health conscious don't vaccinate. I mean, there certainly are. But I think the people that tend to question the system and that are focusing on getting back to the basics and getting back to healthier food and a natural lifestyle, getting zero vaccines goes along with that, because your belief system in general is a natural lifestyle, and so getting a vaccine is not natural per se. It's you're injecting a product in. It's a pharmaceutical, and so that doesn't mean it's right or wrong. It just goes against that ethos. And so I would say yes, certainly more individuals that are unvaccinated live a more traditional lifestyle, and that's what you see with the measles outbreak, right? Like with the Mennonites, or you've seen it in Amish communities, places where people are more traditional. They tend to vaccinate less.
Yeah. And you said before that there's like less censorship right now?
Oh,
like,
way less.
Yeah. Like before you would say even just a discussion like this would have just been taken off like YouTube?
Yeah. Everything.
Yeah.
And
that has just opened up now?
I don't know about YouTube so much. I haven't tested that, but I don't think so. YouTube's still pretty censory. Instagram and TikTok and X are pretty much good at this point.
Yeah, Zuckerberg has.
Yeah, I haven't seen anything in a while on Instagram or X or anything. And people have posted vaccine stuff. I posted vaccine stuff. I haven't had anything that I'm aware of taken down. The posts have done well. And I haven't gotten any strikes against me or anything. So I think that because a lot of it was automatic. I mean, you put the word and then somebody complains about it, it's one thing, but you put the word and it just automatically triggers some sort of censorship or demotion of it. I think that's gone for the most part from those platforms, which is good. I don't know about YouTube. I think you can still post things, but it can demonetize you. I hope YouTube changes that, but I haven't heard that that's changed yet. I don't know. But it's certainly nowhere what it used to be. Right.
Because I think Robert Kennedy used to be not even being able to have an account on YouTube.
Yeah, well, I mean, during the pandemic and around that time, I mean, all the people that were fighting for health, they lost their accounts. Yeah. So I mean, that was the extreme of it. Was anybody who was talking out against any of that stuff would just lose their accounts. If, in the less extreme, your post would just get taken down or would get flagged or would get demoted. They're all back now. So yeah. I mean, certainly on X you can say whatever you want. On Instagram, I haven't noted even a notification on my posts in a while.
With taking a position that you do you risk your medical license?
Probably. I think that anything where you speak out, it's always a risk. Certainly in California, it's a risk. I hope that what I'm saying is not taken in that way. Again, I'm not telling people what to do. I'm not telling people not to vaccinate. The book doesn't tell people not to vaccinate. I think if I did tell people not to vaccinate, it would almost certainly make me lose my license. I believe that people should make their own choice, and I don't think that having people make their own choices on something should be something that should risk your license, but I don't know. Certainly that could be a discussion. I don't know whether I would win or lose that case, but I know it's a reality, but it's the right thing to do. So I think having the discussion is important, and asking questions is important. And I know other people have written books and haven't lost their license, so I think we'll see. It's not out of the realm of possibility, though.
Does it worry you, or
Not really.
no?
It is what it is, and if that's what happens, then so be it. But I hope that you're allowed to ask questions now.
Why do you think most doctors don't want to do what's right, and they just don't want to question it even?
I don't even think they know to question it. I think you're taught vaccines are great, and here are the diseases, and here's what they protect against, and it's kind of a religion, and so you don't really think anything other than that. I think that if doctors were shown other information, they might be more open to it, but I don't think they're even open to the information, and they were never taught it, and it's a little bit of a religion at this point. It's like, we were taught this, that's the best thing ever, we give vaccines, and anyone else that talks about it is a crazy crackpot, and they never hear the other side.
Is there any other topic like the vaccines that you're gonna go after next?
Autism. I think I will do some stuff on autism next, but I think vaccines is by far the top. Nothing's even close to vaccines, because even autism's not censored so much. I mean, the discussion a little bit about like genetics, but vaccines is by far the biggest topic, I think. So I'll be doing vaccines for a while, probably forever now.
and maybe even that, what you said, the connection that we just don't know, the autism vaccine connection.
Yeah, I think that's a huge miss on our part. I think that's a huge failure of medicine for the last decade or 2 decades. We should have a lot more information. We should know. And if it does turn out that vaccines are related to autism at the end of the day, that's a lot of kids that were harmed that didn't need to be. And I think we need to do that research, and we need to figure it out, and we need to figure out what that connection is, because it doesn't mean that you should never vaccinate it. Maybe there's an ingredient in there that is the biggest risk, and maybe you change up the vaccines. Maybe you change that ingredient, and maybe that doesn't cause that risk anymore. Or maybe we realize that, oh, well, if you get 5 vaccines, you don't really have a risk, but if you get 10, you do. And so we can, okay, well, what's the ones that are most important? Or maybe we space it out more. Maybe we don't do 4 on one day. I don't know. Like, it's not all or none. It doesn't have to be that. It could be, how do we do this safely? And if you can minimize your risk from the vaccines and maximize your benefit, then that's what we should be doing. And maybe that's going to turn out to be all vaccines are dangerous, and maybe that's going to turn out to be all vaccines are safe. I don't know what it is, but the answer is what makes kids the healthiest. So there shouldn't be controversy around that. If it shouldn't be controversial to say maybe these things are related in some way. Let's figure out how. If it is, let's get that research. And if you do go and get that research, and let's say you do vaccinated versus unvaccinated prospective trials, and it turns out that the autism rates are exactly the same, well, that's the exact research that someone would want to be confident to give their kid a vaccine. That's what we should be getting. We shouldn't be not getting the research because we don't want to find the answers. We should be getting the research to find the answers. And if we find that there's a problem, let's ask why. And if we don't find a problem, then people are going to be more confident to do it.
It's very hard to think that there's nobody making sure that there is no research, like that there just is none. It's very hard to see like how there's not some sort of like an entity behind making sure that there is no research.
Yeah, well, I mean, maybe the pharmaceutical company is behind pushing back. I don't know. Maybe it is,
or maybe the money, like they just want. They're so focused on making money with this product that, like a vaccine, that everything else gets left behind.
Yeah, and I think it's hard to stop all research, but I think what can and has been done is any research that came out about vaccines and autism was debunked heavily. PR against those people, harming those people's reputation. So there's a lot of fear around doing research on that topic, discussing it. You worry about losing your job. I don't know how much nefarious stuff was done back in the day, but now there's just there's nobody who was willing to do it. Anything that came out was pushed back. So then you have this time frame of the next decade where just nobody wants to look at it because it's settled. And if I do look at it and I find something, my career is going to be destroyed. So I think whether there's somebody doing it actively or not, there's this fear that if you do that kind of research, then if you find something, then what is that going to mean for your career, and how heavily you're going to be debunked at that time? And then also, who is doing the research? Like, a lot of this research comes from the CDC or from places that are very pro-vaccine. So are you going to have the head of vaccine safety doing a bunch of studies showing that vaccines are not safe? They're not going to keep that job very long. So the question is, okay, well, then who is doing that research to actually push back? And there's no vaccine damage research center, right? Like there's nobody doing that research to be able to find it. It's just individuals who generally are anti-vax who then find what they were looking for and then publish the thing, and then the whole study gets debunked right away, and there's all anger around whatever they published. So there's not a lot of incentive for people to do that research. That's why I think we don't have it. There's probably some groups behind it, but I think just in general, there's no incentive to do that research.
And who could do the research?
Well, a changed CDC could do it. Okay. If you had the right people, you could. And what I think would be the best research, if we could possibly do it, would be people that have vaccine-injured kids who have a lot of money, who want to start a study and maybe get people to donate towards that study and create billions of dollars to create something that's not just one person, but a bunch of people behind it and follow kids. I think that's very doable. That if you have some philanthropists with a lot of money that want to look into this research, that you could create your own trial. I think the CDC is going to do it too, but you need lots of studies. It has to be, you can do it around the world too. And you can look at any database that exists with a lot of data and pull information from there. It's retrospective, so it's not as good. But I think you could quite quickly get 100 studies that are pretty good from all over the world if you pull data from the big databases that already exist. And you certainly have databases that have autism diagnoses and autoimmune diagnoses and asthma diagnoses and all sorts of things, and vaccine status. Like, that exists for sure. So they could make a concerted effort to pull that information and see what you find. But that's where, again, it goes back to like what you say, like, why hasn't it been done? Like, how could you not take the, like, Kaiser's data and just, how many people with autism have vaccines? How many haven't? Like, it's really simple to do. And that data certainly exists. So you can only sit here and be like, okay, why? Somebody would have thought to do that, you would think. Maybe just nobody did it because they're too afraid to do it. Or people did it and they found stuff and they were like, I'm not going to publish that. I don't know which one it is. But common sense would say that it should be done, and it should be done really easily. It's much harder to do a prospective trial. That costs billions of dollars. To take the data that already exists costs nothing.
What would be your message to, like, new parents?
For new parents, I would say about vaccines in general.
Yeah, or just to how to, like you said, like I don't know, when you become a parent, it's like it's just this whole realm opens up of now you're responsible for a little baby. Yeah. So you're like overwhelmed maybe to make the right choice.
I think you're overwhelmed, but I think the key is that you do need to understand that health is not going to come at the medical office in general. It's great that your doctor's there and they can diagnose things and treat things as they come up. But at the end of the day, health is up to us. And we have to be aware that the system is not set up for our health, not our food system, not our medical system, not any system. And so it really does come down to you to care and ask questions and to be there for them. You don't always know the right answers, but you do know your own gut, and you can trust your gut, and you know your own kids, and you are their advocate. And I think at the end of the day, we have to be okay asking questions, and we have to realize that it's not woo-woo to ask questions. It's not woo-woo to talk about health. There are many other parents out there, and a significantly growing trend of parents who are asking these questions. And I think it's okay to do that. I think you want to be the kind of parent that doesn't just blindly trust the system. You don't want to trust nothing, but I think it's okay to ask questions and to have some questions and to take health into your own hands, including vaccines. It's not just vaccines. I think it's everything. It's the food, it's the medicines, it's the lifestyle, and vaccines included. Having questions is a good way to parent.
All right. Okay, I think that's it.
Awesome.
And you can get that book anywhere?
Yeah, you can get that book anywhere. So Between a Shot and a Hard Place, it's available on Amazon now or anywhere you can get books, or theshotbook.com.
What about audio?
Audio will be coming out. I'm not sure when this is out, but it'll be probably available in June.
Amazing. I like audiobooks.
Yeah, me too. But that takes longer for whatever reason.
Are you gonna narrate it yourself? Or?
I did a little bit of it, but I didn't have time to do it myself, so
Yeah.
I got a narrator.
Okay, nice. But that's gonna be amazing. And then, yeah, I hope it like reaches even YouTube. What do you think it's gonna be on YouTube?
I don't know. Maybe,
Okay.
maybe not. Probably not. Maybe.
Yeah.
Does the audiobooks go on YouTube? I don't even know.
Oh, I think, or at least like Amazon. That one is a big one.
Well, Amazon it'll be on. It
Yeah.
should be. Yeah, they don't seem to be censoring
Yeah.
stuff. I mean, there's all sorts of hardcore anti-vax books, and they're still there. So I think I'm okay.
Yeah. What about instead of censoring, they just like don't give you the reach that you might deserve?
I mean, that's better than full censorship, but it's still censorship. I mean, at the end of the day, it should just whatever. Like, unless you're breaking the law, then there shouldn't be any reason to do any of that. That I don't know why. Who gets to police that stuff? The morality police. I don't know, but it's everyone's opinions there. I don't know why. We don't need any of that anymore. I think this should just all be gone from all the platforms. It wasn't needed. We didn't have it before, and we were just fine. So I think we just need to get rid of it again, let people make their own decisions, and police the really bad stuff.
Awesome. All right. Thank you.
Thank you.